Hey everyone, it's Zack Beck. Back in 2010, the Affordable Care Act was signed to law by President Barack Obama. Now, this piece of legislation expanded medical coverage to millions of Americans, specifically those dealing with pre-existing conditions. Now, this bill did face significant opposition as well as legal challenges that have led all the way to the Supreme Court. And now here we are 10 years later in the midst of a presidential election cycle where healthcare is a hot topic. Both President Trump as well as former Vice President Joe Biden have competing plans that are going against one another when it comes to addressing the healthcare issues. But specifically, what we found is former Vice President Joe Biden has now unveiled a plan that he is dubbing Bidencare, and what we found is the Affordable Care Act used to be called Obamacare, so he's trying to take the mantle and actually change the marketing of this name and proposing something slightly different than what we had before. So what I want to do in this video is break down what Bidencare is, how it will impact you, and what we should be expecting if he were to be elected as the next president of the United States. So let's jump into it right now. As previously mentioned, former Vice President Joe Biden has proposed a new healthcare initiative, which he is calling Bidencare, and it has 4 pillars that are important to be aware of. The first is that he says he would create a public health insurance option, which would provide more alternatives for individuals to access healthcare. Second, he says that he would streamline healthcare plans to make them both easier to navigate as well as less expensive. Third, he says that he would reduce prescription drug costs through a combination of increased regulation as well as through competition through international markets. In addition, he says the fourth thing would be keeping healthcare accessible to all, including those with pre-existing conditions. Now, those are kind of the general tenets of what he wants to propose in his Bidencare proposal, but what I want to do now is break into detail what this actually means and how you should be planning accordingly if he were to be elected president. Most full-time employees in the United States of America receive medical insurance through their employer. So for example, when you get hired into a company, you end up signing up for medical insurance. Now this can be rather expensive at times, but also it does provide coverage to those in need. What you're going to find though is that this does leave out certain individuals, perhaps gig workers, 1099 employees, and sometimes part-time employees don't have that option as well to be able to receive medical insurance. So you might be asking yourself, where do those people get insurance? And herein lies the problem, and what we're seeing right now with Vice President Biden is that he's proposing in his Bidencare plan to initiate what's called a public health insurance option as part of a broader overhaul of the healthcare system in the United States of America. This particular proposal would actually be a little bit different than the system we currently have because a public health insurance option means that it's technically a government-run option as opposed to going through your employer. Now, what this actually means is we already have some of these programs in place, but they're relatively specific to individuals of a certain age. For example, in the United States, we have a system called Medicare, and Medicare is generally for people above the age of 65 who enroll into medical health insurance programs and then are able to have some of that subsidized by the government. Now, what you're finding is that Medicare is only for those who are of generally retirement age. That leaves out people who are below the age of 65. So in Biden's proposal, he's saying that he would expand the public health insurance option to those below the age of 65. So if you're currently a gig worker, maybe driving for Uber or Lyft, or perhaps you're a part-time employee, or maybe your employer doesn't offer any sort of health insurance, or maybe you're just a freelance person doing work for yourself and you don't have health insurance, this basically would provide you with that alternative. Now, this is very different than saying a single payer option, which has been proposed by many political entities. What a single payer option is basically having everything run by the government, whereas what Biden is proposing in his piece of legislation is that there would be the public option, meaning that you would have the alternative. If you like your insurance, you could keep it. If you are already with your employer and they're providing good health insurance to you, you would keep it. But if you prefer to have the option of selecting otherwise, you could go in that direction. Now, this is something that he is proposing, and it does come with many detractors. You will find that people will generally have a predisposition to say the government isn't effective at running certain programs, and I believe there is certain merit to that argument. But what you will find though is that this does leave people on the outside of insurance looking in, because if you do not have the option of even having health insurance, it could cost you a significant amount of money if you were to have some sort of issue come your way. Back in 2010, when the Affordable Care Act was passed, this was debated ferociously. People were trying to advocate to have a public option included as piece of that legislation, but at that time it wasn't politically palatable. Now we're seeing a slightly different political demographic and a political moment where it might be even more acceptable for people to vote in favor of having a public health insurance option. An additional element of Bidencare is utilizing tax credits as a form of helping expand medical coverage to those in need. What you're going to find though is right now, if you make between 100% and 400% above the poverty line, you do not qualify to receive any sort of financial assistance when it comes to receiving this sort of tax credit. But if you calculate that out, 400% above the poverty line right now in the United States of America is about $50,000. And depending upon where you live right now in the United States, because of cost of living and inflation, $50,000 could still make it very challenging for you to afford out-of-pocket healthcare insurance. So when we look at this, what he is proposing in this Bidencare bill is to eliminate the 400% maximum threshold for those to be able to qualify for this. So it does help some people who might not be able to access public health insurance, so that way they don't have to be able to go that route. They could still receive a tax credit instead. When it comes to streamlining the healthcare system here in the United States, one of the proposals in Bidencare is to eliminate surprise billing. Now, many consumers who have health insurance make sure that when they receive medical care, they do so within a hospital that is within the network of that health insurance provider. But oftentimes people become surprised because they might receive their medical care from a hospital or a provider that is not within the network. Then they end up receiving a surprise bill that is significantly more expensive than what they were anticipating, because now it is not covered by their insurance. So making sure that you have in-network coverage is essential when it comes to actually making sure that you're not spending a ton of money when it comes to receiving medical care. So one of the proposals in Bidencare is to eliminate that altogether. This is a complex area of healthcare, but it is an important one to address, because you might have a family member or a friend, or you yourself have at one point in time been at a hospital that was out of network and you received this massive bill. So hopefully, if this bill were to become law, or some iteration of it were to become law, this provision would become effective, because it would help people reduce the out-of-pocket expenses that they weren't even anticipating spending just for their normal medical procedures. Millions of Americans utilize prescription medication on a daily basis to address a myriad of health-related issues, and what we're finding is that the cost of prescription medication has gone up significantly over the last number of decades. And in that vein, one of the proposals of Bidencare is to try to reduce the cost of prescription medication, and there are a number of ways that he's actually proposing to do so. The first proposal would be to eliminate the exception that exists that prohibits drug manufacturers from negotiating with Medicare over drug prices. Now, this hopefully would be able to cause a reduction in overall drug prescription costs, because now those bigger entities would have to negotiate with Medicare, which supplies a lot of customers to these manufacturers. The second proposal would be to limit the launch prices for drugs that face no competition. Now, this is pretty easy to understand. If someone were to actually, a manufacturer, to come out and have a new drug on the marketplace, clearly no other individual or organization would have the same drug out there, so they could charge just about whatever they want. So what this in essence would do would limit the ability for them to charge astronomical costs as it relates to this particular drug. Specifically, it allows people to have a better access to that medication. So it's one of those areas where you're going to find the government kind of coming into the area of capitalism and forcing a regulation, and I totally get why people would be opposed to that, because perhaps what we're stifling innovation and stifling the incentive for people to create something in the marketplace, because they wouldn't be receiving as much money. But I understand also that there's a balancing factor here, because this is actually assisting people with their health. It's different than if this is a car manufacturer or someone creating just a new product, but when we're dealing with health, it's slightly different. So this is what makes this so delicate of an issue to understand, but eliminating this current limitation would actually allow people to have more access to newer cutting-edge technology when it comes to drugs. The third proposal would be to limit price increases for all brand, biotech, and generic drugs to inflation. Now, you might have seen stories a number of years ago where the EpiPen actually ended up going astronomically more expensive than it was before. And what we're finding is that if we had this type of bill in place, this type of law in place, it would basically prevent any sort of generic drug or biotech or brand name drug from increasing their prices astronomically. So what comes to that is they would adjust it for inflation. So obviously you could increase the price, but it wouldn't be so astronomical that people couldn't afford it anymore. Once again, because we're dealing with the health and safety of Americans, and that's where this does play a role. The next proposal would be to allow consumers to purchase prescription medication from other countries. Now, currently we're prohibited from doing so here in the United States of America, but what this bill would do is expand that ability for people to purchase these medications from other countries, only if they've been certified by the Department of Health and Human Services here in the United States of America. So making sure that people are still safe and secure if they access them, but it would expand the market and allow even for more competition. So people might purchase from Canada, from other countries in Europe, etc., where they might have more affordable health insurance and maybe more affordable prescription medication. The final pillar of Bidencare is he is proposing expanding medical coverage to all. Now this goes beyond the public option and talks a little bit more about specific issues that are important to be aware of. First, he is proposing reducing the maternal mortality rate that is very high in the United States of America. This disproportionately impacts women of color, and it's important to address. Furthermore, he is saying that he would have healthcare exceptions for people no matter their gender identity, or their sexual orientation. Make sure that everyone has health insurance no matter what factor, what area they fit into. In addition, he is proposing expanding coverage and expanding investment into community health centers. Now, right now, depending upon where you live, you might have limited access to being able to receive medical coverage, but health centers generally are close to the community, have the option to provide people with those services that are very important and what they desperately need. So expanding those investments could help people in these specific communities. And lastly, he is proposing expanding access to mental health care. Now this is an important and very often overlooked area of our society that doesn't get talked about that often, but it's so important that we help people when they're dealing with issues, whether that's anxiety, depression, or deeper issues as well. So what I really want to encourage people to be aware of is, irrespective of your political beliefs, irrespective of your philosophy when it comes to this, I think it's important for us to actually have some empathy to anyone who's going through these challenges, because they could be hitting any one of us at any time. The bottom line is Bidencare is basically an expansion of the Affordable Care Act, which was also known as Obamacare. And he might be onto something here, because recently the New York Times conducted a poll and they found that 55% of Americans are satisfied with the Affordable Care Act. But that same poll also found that the Affordable Care Act plus a public option received 67% support. So basically, when you boil down this particular proposal from former Vice President Joe Biden, he is basically taking Obamacare, adding a public option, and that is actually going to be polling quite well. So it's interesting to note that he's finding this political calculation and making these proposals right here at the bottom line when we're getting down to the end of this election cycle. So what I want to talk about now is, what does this actually mean for you or I? Because just making a proposal doesn't mean it becomes law. If you remember, back when the Affordable Care Act was passed, that required both the House of Representatives as well as the United States Senate to pass that legislation, and then it was signed by President Obama. So the same thing would have to take place now. We would need to have the House of Representatives pass a bill, then we would have to have the Senate pass a bill, and then President, at that time, if there was President Biden, he would have to sign it into law. So this could be a very drawn out process. It could take a lot of time and face a lot of opposition, that some of that opposition is very warranted as well. Like I said, we have to ask ourselves, how is this affordable? Who is going to pay for it? And will it actually provide the coverage necessary to address people's current needs? In addition, would it potentially stifle innovation, because you're eliminating the incentive for people to continue to create new drugs, create new opportunities, create new medical supplies, because you might not have that financial incentive for them to do so. This is an important topic, and that's why there's so many variations of views from the Republican side, the Democratic side, as well as the independent side. And the reason why I wanted to bring this proposal and highlight it to you is that if it were to become law, we should be aware of what it actually means for ourselves personally, whether it's going to cost us more money in the form of taxes, whether it's going to provide us with health insurance coverage if you have a pre-existing condition, if you're dealing with any of the other ailments we referred to previously, or if you're right now struggling to pay the bills when it comes to your prescription drugs or anything else to that extent. So I'm not necessarily advocating for this piece of legislation. I just want to provide you with the information so that you can make a well-informed decision moving forward. Now, I know I did not cover President Donald Trump's proposal when it comes to healthcare in this video, but the reason why is that he's been president now for 4 years, and there hasn't been an actual form of legislation that has been put forward when it comes to this. So that's why I didn't feel the need to go into that detail. But basically, my anticipation is that if we have President Trump get reelected, we'll probably retain the status quo, and maybe we'll see certain things change depending upon what the Supreme Court does with the Affordable Care Act. So those are the things I just wanted you to be aware of, because now we're getting down to the wire here with this election, and these decisions that are going to be made by these politicians are going to have a direct impact on the lives of you as well as the lives of your loved ones and your friends. With all that being said, I'd like to thank you for watching the video today. If you wouldn't mind, please like the video. That would really help the channel out for the YouTube algorithm, help push this video to other people who might need to hear it, because you might have a friend or a family member who's going to be directly impacted by this issue, and I believe it's important for them to understand the details so that way they can plan accordingly if it were to become law. In addition, if you have any questions, please comment down below. I'd love to interact with you, get to know you, do any research on your behalf, dive into the details even deeper, and do anything to help you make well-informed decisions moving forward. Furthermore, if you wouldn't mind, please subscribe to the channel. That would mean a lot to myself personally, as I do everything I can to create content that will make a meaningful impact in your life by encouraging you and myself to lead lives of meaning and purpose, all while maintaining balance and moderation. And if you do subscribe to the channel, please tap the notification bell. That will notify you every time I post a video, which I do on a weekly basis. Once again, I'd like to thank you for watching the video today. I hope you have a wonderful remainder of your day. Talk to you next time.